Can PTSD be prevented? Have you ever wondered if post-traumatic stress disorder can be prevented? This is a question that many people ask, especially those who have experienced trauma or know someone who has. Post-traumatic stress disorder, often referred to as PTSD, can develop after someone goes through a traumatic event. It can lead to distressing symptoms like intrusive memories, avoidance behaviors, and heightened anxiety. Understanding whether we can prevent this condition is vital for many. Cognitive therapy, particularly cognitive behavioral therapy, offers some promising methods for prevention. When applied early, these techniques can help reduce the risk or severity of PTSD. The goal is to interrupt the development of PTSD symptoms before they become entrenched. One effective approach is cognitive restructuring. This involves helping individuals recognize and challenge negative thoughts related to their trauma. For example, if someone feels excessive self-blame or helplessness, cognitive restructuring encourages them to replace these thoughts with more balanced ones. Another key method is exposure techniques. This involves gradually and safely exposing individuals to trauma-related memories or situations. By doing this, we can reduce fear and avoidance, which are common in PTSD. This gradual exposure can help prevent the maintenance of PTSD symptoms. Skills training is also important. Teaching coping strategies can help individuals manage anxiety and emotional distress. This training can include techniques to deal with intrusive memories and other distressing symptoms. Research indicates that when cognitive behavioral therapy is applied early to individuals at risk, such as those recently exposed to trauma, there can be a reduction in the development of full PTSD symptoms. However, it is essential to note that more rigorous studies are needed to confirm the effectiveness of these interventions on a larger scale. Systematic desensitization, a specific form of exposure therapy within cognitive behavioral therapy, can help systematically reduce fear and anxiety responses related to trauma cues. This method may prevent the escalation of symptoms. In practical terms, preventing PTSD through cognitive therapy involves early screening of individuals exposed to trauma. Identifying those at high risk is a critical step. Once identified, prompt initiation of cognitive behavioral therapy-based interventions is necessary. These interventions should focus on cognitive restructuring and exposure to trauma-related stimuli. Ongoing support is also vital. Reinforcing adaptive coping strategies can help prevent relapse into PTSD symptoms. While cognitive behavioral therapy is well established as an effective treatment for PTSD, its role in prevention is promising but still requires further validation. In essence, PTSD may be partially preventable through early cognitive therapy interventions that address unhelpful thoughts and promote healthy processing of traumatic experiences. Though more research is needed, the potential for prevention offers hope for many individuals facing trauma.